Welcome to Badass Lady Folk. I'm your host, Christine Stoddard. And this episode, I am so delighted to welcome Dr. Spring Cooper. Hi, Spring.
Hi.
Hi. So you are a sex educator. What does that mean?
Well, I'm a professor, so
You are a professor. Doctor.
Thank you. I teach and do research and do advocacy and service related to sexuality and sexual health.
Mm-hmm.
So my degree is in something called biobehavioral health, which is like an interdisciplinary approach. So we look at environment, behavior, psychology, biology, and how they all intermingle and intertwine to produce or prevent disease. So within that, I study sexuality and sexual health, and specifically of young people, because I'm really interested in, setting up healthy habits and attitudes so that people have happy and fulfilling and like what they want in their sex lives and with their partners. So.
Yeah. So by this definition, what is a young person?
I study like 13 to 25 years of age. So like adolescents and like up through college age, basically. Young people we say cut off as 25. So
Okay, that's when the quarter life crisis hits.
Yeah. You're no longer young after that.
So how did you get into this?
Actually, I had a friend in high school who had HIV, and this person had contracted it through a blood transfusion when they were very young, before the blood supply was tested, which now it's totally safe. You can always trust blood transfusions, but this was in the early 80s. And so they had contracted it, and in our high school, they felt like they couldn't be out about being HIV positive, because in a previous school they had been bullied and ostracized for that reason. So at our school they were not out about it, and they came out as they graduated. And I was young, and I was just so upset that they had faced all this stigma, and that they couldn't live their life as they wanted because of other people's misunderstandings and bad attitudes about like what having HIV meant. So when I went to undergrad the next year at Penn State, there was a nonprofit at Penn State called the AIDS Project, and I started volunteering there. I did a long training with them. They had like a 3-month training that they put volunteers through before they allowed them to do any volunteer work, and it was very intense. And they taught us so much about not only like preventing HIV and other sexually transmitted infections, but also like how to have conversations with people, and how to negotiate condom usage, and how to teach people about things, and how to open up, so that people are willing to like talk about these things. And so I started volunteering at the AIDS Project because I wanted to like help promote understandings and clear up like these types of things that my friend had faced. And I loved it. I loved doing that work. I volunteered at the AIDS Project for years. I ended up doing an internship there, and that was like what really set my interest for grad school and going into this field. So
for people who might be interested in entering this field, what exactly did you study in undergrad and then graduate school?
So my degrees are both called biobehavioral health. That's like a Penn State name for the degree.
Okay. So it's not psychology, sociology, biology.
You could go into any of these things.
Okay.
So many people enter sexuality from various different fields. So biobehavioral health is something very similar to public health, but it's a little it's not necessarily focused on the public, but it's related to public health. So public health is another type of degree people might use to go into sexuality, but also, health psychology specifically, or psychology, or women's studies.
Mm-hmm.
There's so many different avenues to explore sexuality through. And there are a couple of like sexuality programs within the U.S. that are known. The Kinsey Institute in I'm blanking on the state it's in.
I just know they did the big fat book that was very popular.
Yeah, the
Not
Kinsey
here.
Institute. And then also Widener, which is in Pennsylvania, is the other like well-known sexuality program in the U.S. So those are the two places that people normally go if they're like certain they want to study sexuality. But you can study sexuality, through a lot of different avenues. So,
Yeah.
yeah.
So, what is it like being a professor compared to doing field work, compared to doing like public advocacy and all these other things that you've had a hand in?
Being a professor is really cool. I don't recommend people get a PhD unless they want to be a professor, though, specifically. But being a professor...
Was it that brutal?
It's a lot of work. But, as you... Like, being a professor is really cool because you are doing research on topics you are interested in. You're deciding what you want to research. And, like, that's the coolest thing in the world. Like, getting to, like, answer the questions that you want to know the answers to. So I do really enjoy that. And I love teaching, so getting to help train new generations of people in the field is also really exciting. And as a professor, you are expected to do service and give back as well. So advocacy can be part of that, but like there's a lot of different ways people might choose to do that. But I find the advocacy really rewarding. So like all of these are pieces of my job, which I think are super rewarding. Being a professor is also a very laborful, time draining field where you kind of, always are working, but it is very rewarding. So.
What are some of your favorite types of encounters that you have in the classroom, like repeated questions and...
Oh, well, I have taught many types of classes. Right now I'm at a grad school, so I'm teaching master's and doctoral students, but my favorite is to teach undergraduate students human sexuality classes. It's really fun to teach those because people don't get a lot of high quality sex ed, in high school. So a lot of people will enter a human sexuality class in undergrad not knowing a lot about sexuality, even if they are sexually experienced, that doesn't mean they understand any of these processes or how to prevent things that they don't want happening or even how to create really great experiences with partners, And so we get a lot of questions. The most common question, I think you know this. I think you primed me for this. I think I've told you this before. But yeah, the most common question is people love talking about anal sex. People always have questions about that. People love to ask questions about the butt in general. I have a podcast called The Sex Wrap where we answer questions about sexuality, and our episodes that get the most listens are just the butt episodes. High, way above the others.
Wow. Why do you think that is?
I think it's still a little more stigmatized. Also, people... We have a lot of stigma around sexuality in general still. Mm-hmm. So just being able to like open up and ask, even friends questions about sexuality can be hard. So, I think, the more stigma we have around something, the more it becomes difficult to navigate, in your life. So I think a lot of people don't have trustworthy places they can go to ask those questions, unfortunately, which was one of the reasons we created the podcast, because we wanted a well-informed, educated, non-stigmatizing place where people could just go and find the answers to their questions and feel safe and private and, get the download.
Yeah. Okay. Speaking of safety and privacy, you are a revenge porn trailblazer. So could you remind me exactly what it was you accomplished? Because I know it was great. And what terrible situation you were in.
So in January 2018, I had an ex post some images of me, intimate images of me, and posted my name, my face, my contact information with these images. And the first time they went up, I just couldn't believe it. I was like in denial, and I was, messaging all my friends, like, what am I supposed to do? And I went to get an order of protection, a restraining order, that day. But then the images kept going up, and different images would go up, and then videos started going up. And every time my contact information would be shared with them. So then I would get thousands of people from the internet contacting me directly to my phone or through my work email, actually, was information that he posted. So I would have people contacting me, and they would tell me that I was a dirty slut, or that they would share my photos more widely if I didn't do what they said, and they would try to blackmail me, or they would tell me that they had come to my photos that morning and then like beg for more. I mean, all sorts of things. And I was being harassed regularly over the course of most of 2018 because he kept posting, and this was just happening regularly. So I was like, I was just leaving my phone at home. I was like trying to disengage from the internet as much as possible because it was just traumatizing at all times, and I would just be like walking down the street, and like a new set of photos would go up, and then I'd be getting all these like alerts on my phone, and it was like I had been sexually assaulted like right there in that moment, and I'm just standing on the street, and no one can help me, and so the law had been passed in New York City like weeks before my first post went up, and so I was able to press charges. And because it had just been passed, I was the first one in New York City, and New York City passed it before the state, so it was the first one in all of New York. And I was able to press charges, but the police at the time didn't really know the law or understand it yet. They didn't know how to collect evidence. They didn't know how to support me. So, like, the whole process was traumatizing over and over and over. And I'm very lucky that I had a very strong support system. The court case actually took 4 years to complete. It just finished a year ago. Wow. So to actually come to conclusion, and I did win the case, but it was, the whole time was horrible. So like every time we would get ready for court, I'd have to go through all of the details over and over and like relive it over and over. And then something would happen and we wouldn't go to court, and then it would go again and again. So I only stuck with it, to be honest, because I had so many people reaching out to me thanking me for what I was doing because they hadn't been able to do that for whatever reason, because they had a religion or a job or family that they felt like they couldn't press charges, or they couldn't because the law hadn't been passed yet, or whatever was the case. And I would have given it up so many times because it was horrible for me. It was not a good process. That was not a healing process in any way. Right. If anything, it was delaying the healing. And so, but I felt, that this was an important thing to do. And out of that, I've done a lot of advocacy. I'm part of the New York City Task Force Against Sexual Assault, which is an amazing task force. They do so many great things. They're always working to strengthen the laws and to support survivors. And I mean, these things become more and more important, especially as AI-generated images become more and more easy to create, and people can actually create revenge porn so anybody can be a victim, even if you've never taken a photo, even if you've never shared. And I mean, and it's I think it's just going to be more and more of a problem. And so it's something that, we really need to talk about, and like teaching people about consent and teaching people, about respecting people's boundaries. Like these are the things that like we teach at like very elementary levels in comprehensive sexuality education that need to be part of everybody's understanding and vocabulary, so that we have this ability to set the boundaries for ourselves, and so that other people also can respect those and be in conversation with that. And when we ignore sexuality or push it in the shadows and don't talk about it, then that's what is creating the ability for, sexual assault of all types to actually proliferate more and more. And so it's really important that people also who have experienced these things are able to come out and to talk about them and share their stories and get help as well.
Yeah, well, I'm so sorry that happened to you, but I'm also really proud of you and grateful to you. So, for someone who is experiencing an issue with revenge porn, how do they report it? What's the process now if they want to take action?
I mean, you can report it to. It depends on where you live.
Mm-hmm.
Almost every state has laws against it now, though all the laws vary in what type of things count as revenge porn, and also how you can press charges. But going to the police is how you would report it, and then there's different like takedown measures for every site. So every site that you have things posted on, you have to like go to that specific site and figure out how to navigate that. Um, there are some resources that have been created for survivors. I have a website that we've created out of my research for survivors to like help them try to navigate all of these things, like so that they can kind of go to this one place and say, okay, here's like all the different things I need to do. So those we have those available, but it's a nightmare no matter what. Like, I think that we're trying to improve these processes and learn how to help people heal from these things as well. And from some of my research, we found that one of the things that we did some research with people who said they had gotten over cybersexual assault in some way. So we were looking at a strengths-based approach. So people who had experienced and felt like they had gotten over it. So we did in-depth interviews with them to say like, okay, so like what helped you get to this place? How did you get from being in this like victim mindset into like a survivor mindset? And all of the people that we interviewed actually became advocates in some way. So maybe it was at an individual level, or maybe they were like starting marches, there's like a variety of ways that people did this. But this act of like talking about it, of like trying to make it better for other people is apparently incredibly healing. And that was just something that was common that we saw among all the people who said that they had gotten over it. And so on the website that we created for people that had experienced this, we also have tools to like help people think about how they might be an advocate in some way, in what way makes sense for them to like start that process as a way to actually help them on that process of healing.
Neat. Yeah. Oh, yeah. It's very heavy, but it's important.
Yeah.
Gosh. I wanted to go back to consent. And I'm curious about how you teach that to young adults. And if from what I observed, it seems like this national conversation about consent really seemed to start around 2015, 2016. And that prior to that, you were lucky to be in spaces where that was discussed. And I'm curious about what changes, what differences you've noticed in that conversation.
I mean, ideally, we were talking about consent, with people as young as when people can talk. We want to teach people about respect for their own personal bodies, their own personal space, and respecting other people's bodies and space as well. And we like to teach consent as like a very active process. So it's not just a one-time thing. It's a continual process of understanding how someone is feeling in relation to you, and continually checking in on that and asking very specific questions, And so we teach like this even with young kids, like asking before they give a hug, to their little friends, or teaching, aunts and uncles to ask their young people in their lives if they want a hug before just hugging them. So we start with like these very basic ideas of just like asking before touching, asking before coming into contact with somebody, and then continually to navigate that. And the pushback that we sometimes get is people say things like, oh, that's not sexy, or that's not hot. And I have some research that I've done with young people looking at, how they navigate consent. And one of the things that people say that they use to navigate consent is like vibes, right? And they're like, oh, well, the vibes were there, so I knew we had consent. And there's a little bit of a reluctance sometimes to like do a check-in, and sometimes that can come from a fear that if you ask the question, the other person might say no. Like there might be, you know, some fear around like getting an answer that you don't want. But usually when people actually engage in this process, they find it clunky at first. There's like something like that takes a little getting used to about it, but then people actually really do like it. I mean, it is like you feel respected as the person being asked questions, and as the person asking, you also are very sure there's no uncertainty. So like there is no like inner workings like, ooh, is this okay? Is this okay? Like, you know, it's okay. And so it actually gives you this ability to like relax and to soften and be like, oh, I can enjoy this now, you know? So it has like a lot of benefits, not only the certainty that you have consent, but also like I would say like your nervous system can relax. You can actually enjoy, you can have more pleasure by virtue of this process. So yeah, but I mean, teaching it is really just getting people used to it, just getting used to, and like, I mean, you can teach people to just practice it in their everyday lives, you know, like asking before you like touch someone on the shoulder, you know, asking before you give a hug, asking even like, do you like shaking hands? Or would you rather do an elbow bump or fist bump or like whatever, you know, like all of these things are things that can and do bother people actually, you know, especially in a post or COVID world. And so how we're navigating people's boundaries all the time is important and should be, I think, more part of our like everyday thinking process.
What are some of the surprising moments that you have teaching consent to young people? You talked about the pushback, but what is it like to watch the aha moments for them?
You know, I would say that the most like rewarding thing in teaching young people sexuality in general is like seeing this growth and this development, which is why I love teaching the undergrad sexuality classes, because there's more development and growth and it's like so fun. And you know, I have people write these reflection papers, and when you read a reflection paper and they're like, you know, I didn't get this until I watched this movie, or until someone said this thing in class, and it's, you know, it's exposure to ideas that are different than your own, and having them being humanized, having like understand someone else's experience, understand someone else's story. And, you know, when that happens, that's like when the light bulb goes off. That's kind of what is really allowing people to learn, to change, to grow. And so I think, you know, that's so important. Like, and that's like, you know, it's exposure to art and to movies and to things that like, you know, have these broader ideas, but it's also exposure to people that are different than you, and like having open and vulnerable conversations. And like that can be hard to do outside the case of like a, you know, classroom that's specifically devoted to that. And so, you know, I think it's kind of sad that, you know, we don't have a lot of spaces like that, especially like for adults to like to continue to be exposed to new ideas and perspectives, and allow ourselves to like really blossom into our own sexuality and our own like what we want from our sexual lives and partners and things. Yeah.
What are ways that you wish people in their 30s and 40s specifically would approach their sexuality differently, or just practice things differently? Because there is, for many people of this age, the idea that, oh, okay, I've been active for a while now, like I know what I'm doing.
Yeah.
But do we? Like,
yeah. No, of course not. I mean, we all think that, you know, we think like, oh, I've been doing whatever for so long, I know everything about it. I mean, I think like I have this podcast on sexuality, and we explore different topics on every episode. And I mean, we've been doing this for like 6-7 years now, and we still have a backlog of hundreds of questions. Like, we're never going to run out of questions. That's not the problem. But, you know, I think that like anybody can learn more. Like people say like, oh, I know what pronouns are. I know why we use pronouns. I know to respect other people's pronouns. But like listening to a podcast episode about pronouns, you're going to actually learn much more than that. You're going to learn like what it's like for people. You're going to learn like why it's so important, and you're going to like get a little bit of that humanizing, and then you're also going to like get some tips on how to practice it. You're going to like, so like we offer, you know, like not only some baseline information, but then like ways to think about it, ways to like practice it, ways to like think about these things in your own personal life. And so I think like there's always more to learn. And so I would say, like, you know, find the way that you want to learn it. Like you can read books, you can listen to the podcast, you can like do whatever, but like there is always more to learn. And as we are aging, like we are changing, you know, and like a lot of times people have been afraid to try things, whether it's, you know, with the gender of their partners, or even with like how they're expressing their dressing, or what types of activities they want to try. And there's so much stigma around these things that people might have never wanted to try things before, but then as they come into a little more confidence in themselves, or they're understanding themselves more deeply as they age, these things like might come out and they might be ready, but like you also need to be exploring and educating yourself so that you can do that, so that you can like have this like full expression of yourself. So like it's like never stop learning. Like it's sexuality, but it's like everything, you know. It's like go ahead, like find a way to like find some more information about it and like dive into it, because it's only going to help you.
What are you looking forward to with the podcast? What are some next steps? Or are you going to keep doing what you've been doing?
Yeah, I know. I think like it feels like important work. Like it feels like, you know, we're creating something that is easily accessible, that people can listen to from anywhere, you know, with very low startup costs. Like you just have to have a pair of headphones and some type of device connected to the internet, you know? So I really like the accessibility of that and what we're doing. But also podcast listening is going down across all podcasts, even like across the most listened to podcasts are experiencing declines in listenership. So, you know, I think we need to keep thinking, you know, we always need to be evolving. How are we reaching people? How are we like, how are we doing what people need, like in the space they need it, right? So, I mean, I think that there are some problems with like, okay, we could just go to TikTok, but then we're not able to get like the depth of information you want. You know, you would have to have like a chain of like so many TikToks to like get across like what we get through in a podcast episode. So I'm not sure kind of what the next evolution of that might look like. But I think everything needs to keep changing and evolving. So I would say we're definitely not going to do it forever, but for now.
Where should people go to find out more about your work?
The Sex Wrap is the podcast, at The Sex Wrap on any social media platform. You can Google Spring Cooper and find me on the internet. You can find my, you know, whatever you might want to find about me.
All right. Said like an academic. No branding, Christine.
Do you know how to search things?
All right. Thank you so much, Spring. That is all the time that we have. You have been listening to Dr. Spring Cooper with me, your host, Christine Stoddard, on Badass Lady Folk. We are airing on Manhattan Neighborhood Network, Radio Free Brooklyn, podcast platforms, YouTube, etc. And on MNN, we air Thursdays at 1 p.m. Thanks so much. Tune in next time.